Bevacizumab, or Avastin, is a monoclonal antibody protein. It is a targeted anti-cancer drug that attacks the cancer blood vessels supplying nutrients to the cancer. It is not a chemotherapy and therefore does not cause any of the usual side effects of chemotherapy. Avastin is commonly used to treat ovarian, cervical, kidney, brain, colon, and lung cancers. It may be used on its own as a single-agent therapy, but more often it is combined with chemotherapy. Avastin is administered once every 2 or 3 weeks. It is given as an intravenous infusion, typically over 30 minutes. The first time you receive Avastin, the doctor may prolong the infusion to 90 minutes. This is to monitor and ensure you are not allergic to the medicine. The second time, Avastin is usually infused over 60 minutes, and thereafter each infusion is administered over 30 minutes. As mentioned earlier, Avastin is not a chemotherapy, and therefore patients do not experience any of the typical side effects of chemotherapy. For example, it does not typically cause any hair loss, nausea, vomiting, tiredness, constipation, or weakened immunity. Most patients receiving Avastin as a single agent are well and feel almost normal. However, Avastin does have less common but important side effects. Because it targets blood vessels, it can cause bleeding, bowel perforation, or fistulae, which are abnormal communicating passages between organs. The likelihood of bleeding varies from patient to patient and may be affected by factors such as the type, extent, and location of your tumor, or the type of chemotherapy you may be on. However, the risk of major bleeding is generally low, ranging from 0.5% to 7%. If you are on treatment with Avastin for lung cancer, you should inform your doctor if your cough and phlegm has blood. You should also inform your doctors if you pass blood in your stools or if you have sticky, blackish or purple colored stools, as this may indicate digested blood. Avastin may also cause intestinal perforation, which may be a life-threatening emergency. However, this is rare, occurring in approximately 0.3 to 3% of individuals. If you have a history of multiple intestinal surgeries, active stomach ulcers, diverticulitis, or have a tumor that is invading through the wall of your intestines or causing intestinal blockage, then your risk of bowel perforation with Avastin may be higher. One of the most common side effects of Avastin is elevation of blood pressure. When you are on Avastin, it is important to check your blood pressure regularly. It is a good idea to buy a home blood pressure monitoring machine from your pharmacist and practice recording your blood pressure. As blood pressure fluctuates during the day, home blood pressure monitoring may sometimes be even more accurate than readings taken in a doctor's clinic, if you learn how to do it properly. Blood pressure readings consist of 2 different numbers: the upper, or what we call the systolic blood pressure, and the lower number, which we call the diastolic blood pressure. In general, we should aim to keep the systolic blood pressure to less than 130 or 140. Readings consistently above 140 warrant treatment with blood pressure control medications. Poorly controlled blood pressure may sometimes lead to hypertensive emergencies, where the blood pressure rises to very dangerous levels, or it may increase your risk of heart attack or stroke. Avastin can increase the risk of heart attack, stroke, and blood clots. If you have a history of heart disease, stroke, arterial thrombosis, or deep vein thrombosis, your doctor will have to balance the risk and benefit of Avastin for you. Avastin can sometimes cause protein leakage from your kidneys into the urine. Your doctor may therefore monitor your urine for protein. If you are a woman with childbearing potential, it is important to use contraception during treatment, since Avastin can cause serious fetal malformations. Although Avastin therapy sounds frightening, it is useful to know that it is one of the most commonly used anti-cancer drugs. Many patients do not experience any significant symptoms or side effects during their treatment with Avastin and derive significant benefits from the improved control of cancer. Many patients on Avastin are able to continue relatively normal lives. For more information on Avastin, please consult your doctor. You can also find out more by clicking on the links accompanying this video.